Welcome to module number 18, which is AI in journal reading. Not only reading, whatever evidence is synthesized in and around, with the advent of AI, a lot of things have changed. To take us through this journey, we have one of the eminent speaker, Dr. Nitin Yashas, who is joining us, and the other person who is across the continents, Dr. Dsouza. Unfortunately for the teaser, he is not able to join, but he is going to join for moderation on this Wednesday, that is 27th of May 2026. To give a brief introduction, Dr. Nitin Yashas is a consultant medical oncologist and hemato-oncologist at Manipal Hospitals, Bangalore. He is the recipient of G.S. Bhattacharya All-Rounder in Oncology Award. He is also a passionate quizmaster and has conducted over 75 oncology quizzes in the last 4 years. He has a keen interest in the field of immunotherapy and precision oncology and has presented many original research in multiple national and international forums that makes him one of the best speakers to take this topic. He has been keenly involved in the intersection of AI and healthcare and has been collaborating with scientific institutes for research in AI in radiomics, malignancies such as lung cancer, and as a part of the organizing AI literacy session for medicos, including those serving in the rural areas. Welcome, Dr. Nitin. Let me introduce the moderator also. Your moderator is going to be Dr. Dsouza. He has recently received NBEMS Merit Award for its extraordinary contribution towards education in India, one of the very rare things and very rare feats to achieve. He is internationally respected academician, psychiatrist, educator, and global thought leader in bioethics and medical education. That makes him cover the topic that is ethics in publications and in the era of AI and plagiarism as well. He serves as a director, Department of Education and head of Asia Pacific Division of UNESCO. He is the chair of bioethics in UNESCO and has contributed immensely towards advancing ethical medical practices, leadership, mental health, and humanistic healthcare across continents. A visionary mentor, prolific academician, advocate of compassionate healthcare, his works brings medicines, ethics, psychology, organizational well-being, and education with remarkable global impact. His contributions include inspiration of multiple generations of clinicians, educators, and his contributions towards the journal publications is immense, which I can't read in next. It takes multiple times. Coming back to the topic, Nitin, let our viewers know why they should know and understand the role of AI in the evidence synthesis, evidence reading, publication across all the domains. Over to you, Nitin.
Thank you so much, Dr. Suresh Atili and the DNB for giving this opportunity. All I can say is that in today's era of information overload, how can we use AI for better reading of journals, evidence synthesis, and more importantly, how can we use this into clinical application? Now, with so much information and limited time, this session is going to focus on what AI tools can be used for smarter reading of journals and faster reading of journals. Not only that, we are also going to show as to how you can compare different papers and different articles and arrive at clinically meaningful conclusions which we can implement in clinical practice. Also, most students sometimes and even faculties struggle to find research topics. So I'm also going to show what are some of the tools that can be used to identify the current existing literature and the gaps in those literature. One of the things that always comes to our mind is when we attend conferences is how many papers are for a particular treatment planning, how many are against. So we are also going to show tools which is going to show evidence papers which are for a topic and against a topic or neutral, and how you can draft a literature review also by looking at these things. And more importantly, whenever we are using an AI tool, we need to realize that the responsibility still lies on us. We are using these tools to augment faster and smarter reading of journals. But at the same time, I would also be drawing attention towards how to recognize hallucination, bias, and with the ever-changing laws as well, what are some of the things which as medicos we need to be aware of when we are using these tools? So in short, how can we read journals? How can we even create infographics and PowerPoint presentations from these journals? How can we use AI tools to appear very smart in a journal club? And how can we compare the huge amount of information and synthesize them to arrive at clinically meaningful discussions? These are going to be some of the highlights. Do join in for the session at 4 p.m. on this Wednesday, May 27th.
Thank you very much, Nitin. I hope you're going to cover the AI plagiarism or when not to use AI also. I hope that is going to help our readers on how to just read whether it is AI generated or human written sort of thing.
Yes, we'll definitely
Thank
cover
you very
that.
much. Looking forward hearing your lecture. Thank you, Nitin, for accepting it.